Well, a warm welcome to today's talk. It's Saturday evening, the 17th of January. And I've gone on a sort of light duties today and made a bit of vitamin D in the garden, which of course is always nice. Now, I want to focus mostly today on the United States. There is quite a few concerns there at the moment. I'm just going to do a few orientation slides first of all to give us a bit of background. So here we see the position now. Australia, Canada, New Zealand, of course, low. Now, Australia, we are going to talk about that probably. I'm expecting a report tomorrow. More cases in Australia. Unfortunately, after doing so well, it really is quite heartbreaking to see that in Australia. Canada on the way down. United States is on the way up. Ireland also on the way up. South Africa almost certainly on the way up, because we know that there's been reporting difficulties with a recent unrest in South Africa. And of course the UK pretty high in terms of new cases per million there, the English speaking countries. And of course today's the 17th of July today. Got Sunday, then the 19th when the legal restrictions are lifted. So me and Winston have decided to keep wearing our masks. So Winston's still got his mask on and is going to wear it after the 19th, as am I. And I think people should carry on doing that. Perhaps more on that later. Really important we don't go mad on Monday in the UK. But as unfortunately some people do seem to be planning to do. Don't want that just now, want this one. So yeah, so they're the English speaking countries there. Now, quick sketch of Europe as well. So quite a few European countries are quite low, but France about the same level as the United States there, but going up. Belgium, Denmark, Greece, Spain, dramatic increase in the Netherlands, absolutely dramatic. United Kingdom and Cyprus still very, very high indeed in terms of new cases in Cyprus. Relatively low population, but a high proportion of cases. Now, just to lead us on to the report on the United States, I just want to show another slide here that's really quite pertinent to lead us into that. And this is it here. Now, these are the vaccine doses administered per 100 people. It's not first or second vaccine, just the number administered. So we've got Canada and the United Kingdom fairly high. United States is what, 10, 15, 20% almost behind the UK. So we've got the United States less vaccinated than the UK. But we've just seen what's happened to the cases in the UK because of the Delta variant. And the same kind of increases could happen in the States, unfortunately. So that's kind of what we're focusing on today, really. So this is Delta variant driven, this problem. And it's the main issue is the lack of the vaccine uptake, which we see here. So this graph here is a daily count of total administered doses reported to the CDC by Data for Administration in the United States, and the number of daily vaccine doses is way down. I mean, I think we could call this basically a vaccine or stagnation almost. I mean, new doses are going out, but very low numbers compared to the whole population. So Delta variant, on the week, 70% new infections in the States. So it's up quite a bit. Hospitalizations up 36% in the week. Now, still a lot lower than they were, of course, massively lower. Now, in some areas, this is causing difficulty. Missouri, for example, but most areas, it's manageable at the moment, but it's trending up. Now, we're told that 97% by the CDC of those admitted to hospital are unvaccinated. 97% of the people are unvaccinated. So 3% of the people that are being admitted to hospital are vaccinated. And this isn't surprising because we looked at data from Israel just, was it yesterday or the day before, very recently, when we saw that older people can be more likely to be readmitted than admitted after vaccination than younger people. And we saw the comorbidities, the hypertension, the chronic lung disease, the chronic kidney disease, the chronic diseases, the immunosuppression, people with cancer that we looked at. So I suspect the 3% that are getting hospitalised in the States who have been vaccinated are going to have a similar data profile to the Israeli data, but we don't have the data yet from the States, but that's what we would expect. Deaths up 26% on the week. And now the CDC have said that almost all the deaths are in the unvaccinated, but it would be nice to get a figure rather than saying almost all, but that's what we've got. Whereas for the hospitalisations, we do know it's 97% are unvaccinated. Now, quite a few people, Rochelle Walensky, Dr. Fauci, all on TV yesterday and today, saying there's basically two Americas now. There's the vaccinated America and there's the unvaccinated America, and I'm afraid that is largely true. And the Delta variant will just run riot through unvaccinated America. Vaccinated people will still get it. They're less likely to pass it on, but they can still get it, but they're very likely to have mild symptoms. And as we've seen, 97% of hospitalisations are in people that are unvaccinated. So some a surge in the States, and there's going to be a surge of hospitalisations in the States also in people primarily that are unvaccinated. This is inevitable. We can see it's coming. It's almost baked in because of this Delta variant that's caused such a global problem. So Rochelle Walensky, CDC director, this is becoming a pandemic of the unvaccinated, direct quote. We are seeing outbreaks in parts of the country that have low vaccine coverage, direct quote, because unvaccinated people are at risk, direct quote, all pretty obvious. And the increase is actually all over the country, but it's uneven in different parts of the country. Now, Anthony Fauci said that the Delta variant is more than 70% of cases at the moment. Now, if it's 70% now, it's just a matter of a week or so until it's essentially 100%. It's going to just, it just becomes the dominant variant by far. That's going to happen. I can just see it's just we've learned this in the UK, and I've just got this awful deja vu feeling about the United States now. Young people have been particularly hesitant about getting the vaccine, therefore there's more young people getting the infection. Hospitalised to a greater extent than they were earlier in the pandemic. So there's more young people hospitalised now than in the earlier part of the pandemic, in large part because most older people have been vaccinated. So hopefully most of these young people will do well, but we know there's a minority that don't. Now, it's not entirely, but it's largely in the southeastern states that are low vaccine levels, but California as well, actually. Four worst states account for 41% of the new infections. California, Texas, Missouri, and Florida are the worst affected states at the moment. Florida boasts, if that's the term, 20% of new infections, 45,000 cases last week. And it's kind of midway Florida. It's not the lowest, but 47% of the population there are fully vaccinated. So, but of course, Florida, pretty highly populated state, so it's not surprising it's spreading more quickly than the sparsely populated states. Response-wise, LA County, for example, masks now required in public places. So, of course, the CDC has not reinstigated mask wearing in public places. It doesn't seem to have any plans to do that, but it does make it clear that local jurisdictions are of course, free to implement their own localised regulations, and that's what LA County's done because of the increase in cases in California, of course. Tennessee, last 2 weeks, 310% increase in cases. This is pretty dramatic stuff, Delta variant driven. Now, breakthrough infections, of course, are infections that people get despite being vaccinated. Now, this is actually not reported by the CDC. They're not reporting breakthrough infections, but this was a survey done by NBC News. 27 states to NBC News have reported 66,000 breakthrough infections. That's 66,000 people who have been infected despite being fully vaccinated. And this surprises me not one bit, because we've seen exactly the same data from the COVID symptom study in the UK. In fact, next week in the UK, vaccinated people testing positive will outnumber unvaccinated people testing positive. But of course, the vaccinated people get much, much milder disease on average. They get fewer symptoms. The symptoms last for longer. And Tim Spector has told us unambiguously that vaccinated people get less long COVID. Now, we don't know how much less. We're expecting the Tim Spector group to publish that hopefully in the next week. So we know they're getting less long COVID. We just don't know how much at the moment. But we do know that long COVID is affecting about 1 million people in the UK at the moment. This is a huge issue. And about a third of those, so well over 300,000 people in the UK, have had long COVID for a year or more. So 1 million sufferers in the UK at the moment. Over 300,000 have had symptoms for a year or more. This is a concern. This is a major dent in the workforce. It's a major economic dent. And of course, it's a devastating effect on the lifestyle and suffering of these 300,000 individuals. Let's hope the other 2/3 of a million get better really quickly, but sadly, a proportion will go on to suffer longer term symptoms. So, in the United States, there is an awful lot of people with long COVID now, and there's going to be an awful lot more. It would be good to get some numbers on that, but the population is no different from the UK, so it's fair to extrapolate from the UK data to the United States. Hospitalizations are rare as a result of breakthrough infections, as we've said. Well, they're not that rare. There's 66,000, but actually that doesn't concern me, and it doesn't particularly worry me because there's 66,000 infections. No, that's right. It is true. 66,000 infections, but few hospitalizations. So yes, sorry, my correction. Hospitalizations are in fact rare. So testing positive, not rare. Hospitalizations rare in breakthrough infections for people that are getting infected that are already vaccinated. Now, a bit of a fight breaking out in the States by the looks of it between President Biden and Facebook. Vaccine misinformation is killing people, President Biden says. And 66% of unvaccinated adults have been found to believe vaccine myths. Now, Dr. Murthy, the new Surgeon General, has been commenting on this. And they've published this new publication here, Confronting Health Misinformation, US Surgeon General Advisory Building on Health Information Environment, on a healthy information environment. Now, these Surgeon General's advisories aren't actually released that often in the States, and they are an indication that they are concerned. So it's not common in the States that they get these kind of emergency updates, really, but the Surgeon General Office has released this one. And it's actually quite interesting. There's lots of things on this about the different ways that information and things are communicated. But this is the Surgeon General. I'm urging all Americans to help slow the spread of health misinformation during the COVID pandemic and beyond. Health misinformation is a serious threat to the public. It causes confusion, sows mistrust, harms people's health, and undermines public health efforts. Limiting the spread of health misinformation is a moral and civil imperative that will require a whole-of-society effort. So that's from Dr. Murthy, the Surgeon General. And it really is quite an interesting read, actually, because it comments really, it's really a comment on a lot of the way that we get news and things in this current environment. In recent years, the rapidly changing information environment has made it easy for misinformation to spread at an unprecedented speed and scale. That is true. And of course, the old adage is that bad news spreads a lot faster than good news. So quite a lot there about different things that individuals can do, that organisations can do, and indeed tech platforms can do. And an interesting thing there, there's what they call misinformation super spreaders. So taking the language obviously from the pandemic itself, that some people are super spreaders of misinformation and have the potential to do significant harm. Now, there is legitimate debate going on around everything. Of course, vaccines are good. They're saving a lot of people's lives, but the side effects with vaccines, and some people have severe side effects from vaccines. There's no two ways around that. There's a big debate going on about ivermectin at the moment. To me, the evidence is there that it's an effective medicine, but that's being debated. But what I'll always try and do is give the evidence. What we need to be aware of is people that are giving information without evidence. So if anyone says something to you, doesn't matter what it is, the earth is flat. Okay, that's interesting. And what's your evidence for that? You're always free. I'm giving you permission. Always ask anyone who says anything to you, well, what's your evidence for that then? I mean, that's always a reasonable question. Always a reasonable question. So a reflection on the current place we're living at the moment, really. During this pandemic, health misinformation has led people to resist wearing masks and to choose not to get vaccinated. All of this has led to avoidable illness and death. So this has led, pretty strong words really from the Surgeon General. Avoidable illness and death. Simply put, health misinformation has cost lives. So there we go, from the Surgeon General. Now, hesitancy, leading on to hesitancy, vaccine hesitancy in the States. This is from the Census Bureau. That's the link for that there. Masses. I had a look on this today. I actually got distracted in it for about half an hour. There's just masses of information on the United States there. Very interesting. But we'll stick to the point. This is part of the Household Pulse Survey COVID-19 vaccination tracker. 10.8% of US adults 18 years and older are hesitant about receiving the COVID-19 vaccines, according to the census data. So that means if only 10.8% are actively hesitant, then there's quite a few percentage that just haven't gotten around to it yet. Because I think at the moment we're on 68% of the population. Okay, that's adults, that's the whole population. 68% of the population has had one dose of the vaccine or more, whereas President Biden, of course, wanted 7% for the 4th of July. And was way under that, and indeed still is under that. Okay, it's probably 69 by the time that the CDC update the data, but it's still relatively low. But it looks like more people are prepared to get the vaccine. Now, national reasons for vaccine hesitancy, quite interesting. The majority concerned about side effects. I'll read this in case you can't see it. Don't trust COVID-19 vaccines. Don't believe I need it. Don't trust the government, 34.4%. Plan to wait and see if it's safe. Let someone else try it first. That really is the most... that's not a very brave one, is it? Wait and see if other people like it first. Other reasons, whatever they are, a conglomerate, I suppose. Don't know if it will work. Don't like vaccines in general. Doctor has not recommended it. Think other people need it more. And concerned about the cost. Shouldn't be an issue because it's all supposed to be free, of course. Well, it is free. So interesting reasons for vaccine hesitancy there in the States. But it's going to cause a massive increase in cases, and the people that are unvaccinated are the ones that are getting hospitalised and will indeed spread it more because they're likely to have a higher viral load. Now, I know I've taken quite a bit of time there, so I'll just do the UK very briefly. As we look forward to, is that the right word? Look forward to, shake with trepidation in anticipation of Monday the 19th when the legal restrictions are lifted. And there are quite a few people are going to sort of make a point of this. But the more that we go back to non-pandemic behaviour, the more rapidly hospitalisations will rise. There is no question about that. And where are we at the moment? It's still not particularly good. So testing positive, another 54,674 in the UK. Now, this is, we did say about 2 weeks ago that we could have got to 50,000 a day by Monday. It looks like we'll be nearer 60,000 a day by Monday, because this has gone up progressively all week. But another 54,674 in the last 24 hours. That's another 300,000 in the week, up 40% on the last 7 days. And here's the graph. Can we get all that in? There we go. So that's the peak in January. That's the peak now. So we're kind of, where are we? We're kind of about, that's roughly level. Kind of about where we were at the early part of January in terms of number of cases. Of course, we're very hopeful this is going to transpose through to less severe illness, hospitalisations and deaths because of the massively different vaccine status. But that link is not completely broken. So given that this has been going up so dramatically, we know that hospitalisations will be going up soon. Even though the link is weakened, it's not broken. And it was 740 people admitted in the last 24 hours. So unfortunately, we are heading towards what the government feared of 1,000 admissions, hospital admissions per day. That is quite feasible by certainly by this time next week, unfortunately. Over the course of the week, we've had 4,313 hospital admissions with COVID-19, up 39.4% on the last 7 days. Deaths, we've had 41 in the past 24 hours, 284 in the past 7 days, up 47.9%. So we see the deaths are up slightly, the hospitalisations are up more, but the cases are up dramatically and will carry on going up dramatically. So that will cause some increase in hospitalisations and hopefully, some increase in deaths, but hopefully much less. But there is a potential for strain on the health service here. If people go mad on Monday, then there's going to be a significant strain on the health service 2-3 weeks later. If people are much more moderate in their behaviour and carry on wearing masks like we are, then things should be much better. So as Jonathan Van Tam said, don't rip the pants out of your freedoms on Monday. Even though it's legally the case, we have to live in consideration of others. And let's hope most people choose to do that, but we will see. Now, it's interesting. I've actually been booked by the German TV to do an interview on this on Monday night about the reopening in the UK. I'm hoping to be able to report that everyone in the UK has been very moderately behaved and is carrying on essentially as they were last week. I fear that is not going to be the case. Therefore, hospitalisations are probably going to increase. And the world is watching the UK as we open up with our level of vaccine, with the levels of freedoms that we're going to have, with the Delta variant. Just what is that going to do? The positive side of it is that people that have been doubly vaccinated and have waited 3 weeks since their vaccine, if they become infected, they're remarkably likely to have a minor illness and the infection will give them a boost. Most of the young people being infected will have minimal symptoms. Some will be hospitalised, but most will be minimal. So even though the government have never admitted it, they're going for a herd immunity strategy. Now, a few people asked yesterday if Winston had stopped wearing his mask. Well, he hadn't. It was just that he was wearing. He was wearing this one, which is his. Now, some of you might recognise that's actually the Campbell tartan. So he was showing family solidarity and wearing the Campbell tartan, which is that. I think that's the Campbell military tartan. So I think my ancestors used to cause fights. Now, I've got some new artwork. Bob and Jan have kindly sent me this from British Columbia. Thank you very much, most kind of you. From a Canadian artist called Ice Bear. And I'm a complete artistic philistine, but I'll show you that. I'll show you it tomorrow. I think we'll do that tomorrow. But we'll have a look at that tomorrow. We've gone on a bit long today. But it's just been so kind of people to send me quite a lot of art, even though I don't appreciate it as much as I could. It's remarkably kind of people, and it just shows that everyone can express their expertise and their talents in different ways, which is absolutely brilliant. And thank you for taking the time to watch this video on your weekend.